Hello, I'm Dr. Tanveer Khan. I want to talk to you today about high blood pressure. High blood pressure is one of the most common cause of killers. It's indeed regarded as a silent killer. And a lot of people have this problem without even realizing that they have this. Now, what is high blood pressure? I just want to explain to you in simple terms. High blood pressure, or hypertension as you call it in technical terms, is nothing but a sustained elevation in the pressure of the blood flowing through the blood vessels or the arteries. And because of the sustained elevation in the blood pressure, it can cause injury to the blood vessels as well as to the organs, and it can be an irreparable damage. And a blood pressure, as we know, is usually recorded in two numbers. There is one systolic blood pressure, which is the higher blood pressure. That is generated because as the heart contracts, the blood pressure increases. That's called systolic pressure. And the heart relaxes, the blood pressure falls to a particular level called the diastolic pressure. And this usually happens with every beat. The blood pressure goes up to a particular level and comes down, systolic and diastolic. It normally remains within the range of about 120 systolic and about 80 diastolic. But when the pressure crosses, systolic pressure crosses at 135 and diastolic crosses 85, then we say a person has high blood pressure. And this sustained blood pressure, as we said, is a silent killer, and this can cause a lot of damage. What damage does it do? Sustained high blood pressure can cause damage to your eyes. People can lose their vision. It can cause damage to the brain, resulting in stroke. The heart itself becomes hypertrophied and can result in heart failure. The kidney is one of the most common causes for kidney failure in the world. People ending up on dialysis is high blood pressure. And similarly, high blood pressure also results in one of the most important causative factors for ischemic heart disease and heart attacks. Now, the good news is that high blood pressure can be controlled easily if detected in time and by instituting certain lifestyle changes. Now, one of the most common causes for high blood pressure is lifestyle related due to high salt intake. People don't realize what they are eating: fast food, processed food, chat items, soft drinks which have very high content in sodium, and similarly pickles for that matter. A lot of these high salt content results in high blood pressure. Similarly, being overweight, having an unbalanced diet, leading a sedentary lifestyle, heavy smoking, excessive alcohol intake, all these result in high blood pressure. Now, what can you do to make sure that you are not one of the victims of blood pressure? And even unfortunately, if you do become one, how can you control this high blood pressure? You can visit your local doctor. They will check your blood for your height, your weight is matched, and make sure your body weight is ideal. And three, eating a balanced diet is extremely important. Lots of fresh fruits and vegetables in your food, appropriate amount of dairy items, and if you're a non-vegetarian, please cut down on the red meat. This will definitely help you with cutting down on your blood pressure. And cutting down on salty food, as we said, is extremely important step. No matter what medicines you take, if your salt intake is not regulated, your blood pressure will not be under control. And last but not the least, very important thing is once you have blood pressure, please take regular medications. Very important to keep, in spite of taking medications, to see a physician on a regular basis. It's quite possible, in spite of taking medicines, your blood pressure may shoot up and you may not even know, and you will end up with complications. A lot of people have this misconception that they have high blood pressure, they take medicines, and the blood pressure is controlled, and they think the blood pressure is cured. And just like sugar problem does not go away, this hypertension, once you get it, is a lifetime problem in most of the patients. So you have to continue to take medications. As long as you take medicines, the blood pressure will be under control. And if you stop medicines abruptly, your blood pressure will shoot up. You might end up having a stroke or a vision problem or some permanent damage to one of the parts of your body. So my advice is, in addition to your lifestyle changes, regular follow-up with your doctor, taking your medications regularly is extremely important, and do not stop medicines abruptly without the advice of your doctor. Thank you.